Tick season alert! Essential tips to avoid bites and prevent Lyme disease. It's that time of year again. Tick season is upon us, and it's crucial to be informed about these pesky pests. In Grand Rapids, Michigan, reports indicate that this year is likely to be particularly troublesome for tick bites. According to the Centers for Disease Control and Prevention, CDC, emergency room visits related to tick bites have surged this July, surpassing the numbers from the last 8 Julys. Corewell Health has noted that the number of tick-related complaints has nearly doubled compared to the same period last year. But why is this happening? Elizabeth Sewing, a physician assistant at Corewell Health, sheds light on the situation. With warmer winters and wetter springs, ticks are thriving longer and spreading more easily. Additionally, more people are enjoying outdoor activities, and there's an increase in deer and rodents, which are known carriers and breeders of ticks. For those who love the outdoors, whether it's children playing in the yard or pet owners taking their furry friends for walks, taking preventive measures against tick bites is essential. Here's what you can do. When heading out for camping or hiking, opt for long pants and long sleeve shirts to minimize skin exposure. Don't forget to apply bug repellent containing DEET, which is effective in keeping ticks at bay. For pet owners, veterinarians can provide various flea and tick prevention options to protect your pets from these pests. If you discover a tick attached to your skin, it's important to act quickly. Use a pair of tweezers to grasp the tick as close to your skin as possible, pinching it at the neck where it is embedded, and pull it out gently to ensure the entire head is removed. Be aware of the symptoms. Tick-borne illnesses, such as Lyme disease, can manifest through various symptoms, including fever, chills, headaches, body aches, rashes, and swollen lymph nodes. If you suspect that a tick has been attached to you for more than 36 hours, or if you start experiencing any of these symptoms, it's vital to reach out to your healthcare provider. And this is the part most people miss. Many individuals underestimate the risks associated with ticks. What are your thoughts on the increasing tick population? Have you or someone you know had a tick bite experience? Share your stories and opinions in the comments below. Protect yourself from ticks and Lyme disease. Essential tips for summer safety. As summer reaches its peak, health experts are sounding the alarm about a surge in tick activity, posing significant health risks to those outdoors. With over a dozen tick species found in Iowa and Illinois, the black-legged pick, also known as the deer tick, is the most prevalent in eastern Iowa and the Quad Cities. This same species is notorious for carrying Lyme disease, a bacterial infection that can lead to severe complications if not treated promptly. Tana Rosecrans, the founder of Ticked Off Lyme Foundation, Inc., advises wearing protective clothing to minimize exposure. She recommends donning long sleeves and long pants and tucking the bottom of your pants into your socks to prevent ticks from climbing up your legs. Additionally, using EPA-approved repellents containing DEET can provide an extra layer of defense. However, ticks can sometimes find their way indoors, which is why daily tick checks are crucial, even if you haven't ventured into wooded or grassy areas. Pay close attention to common hiding spots: behind the ears, in the scalp, under the arms, around the waistline, behind the knees, and in the groin area. If you do get bitten, the most common early sign of Lyme disease is a red, circular rash that resembles a bullseye. It's essential to seek medical attention immediately if you notice any symptoms or if the bite area becomes irritated or starts to spread. But here's where it gets controversial. Some experts argue that the use of DEET-based repellents might have long-term health effects. What do you think? Should we be exploring alternative repellents? Share your thoughts in the comments below. Preventing tick-borne diseases, essential tips and emerging research. As temperatures rise, ticks are expanding their range northward, leading to a surge in tick-borne diseases. Spending time outdoors is a healthy activity, so avoiding nature isn't the solution, explains Nick Ogden from the Public Health Agency of Canada. Instead, we need better strategies to manage the risk. Traditional prevention methods, such as wearing protective clothing and using insect repellents, have remained largely unchanged, despite the increasing number of cases. These methods, while helpful, are not sufficient. Lyme disease and other tick-borne illnesses can be challenging to diagnose and may lead to long-term health issues. Preventing tick bites is crucial, and research in this area is active. With climate change exacerbating the problem, there's an urgent need for improved prevention strategies and greater awareness of effective methods. Basic tick bite prevention tips: wear long sleeves and pants, and remove and wash these clothes after outdoor activities. Use insect repellents containing DEET or picaridin. Treat pets with monthly acaricides to prevent them from bringing ticks indoors. Create a gravel barrier around your yard to deter ticks. Keep your lawn mowed. Consider using permethrin-treated clothing, especially for outdoor workers. Stay on trails when hiking to avoid overgrown areas where ticks are more common. Regularly check yourself and others for ticks after spending time outdoors. Innovative prevention strategies: rodent-targeted methods, using tick tubes or bait boxes treated with pesticides can help reduce tick populations by targeting the rodents that ticks often infest. Deer-targeted methods: devices known as four-posters apply tick treatments to deer as they feed, helping to decrease tick numbers in areas with high deer populations. Landscape management: controlled burns can significantly reduce tick numbers in larger areas. Vaccines and prophylactics: a new Lyme disease vaccine, VLA15, is in phase 3 clinical trials, showing promise for future prevention. Additionally, a monoclonal antibody treatment called Lyme Prep is also under development. The increasing prevalence of tick-borne diseases, driven by climate change and human activities, underscores the need for diverse and effective prevention strategies. Offering a range of options, including vaccines and treatments, can help increase their adoption and better protect public health.